Hello, and welcome to my colleagues and professional family at the National Association of Pediatric Nurse Practitioners. My name is Dr. Jessica Peck, and I am so honored to serve as your president this year. This spring, with the emergence of the COVID-19 global pandemic, we began to clearly see health inequities that have existed for years laid bare and rise to the level of public conversation. This only intensified with the racial injustice that has dominated the headlines over the summer, and our concern for the health impacts of racism only intensified. We know as an organization we need to do more. You will soon hear news about a new town hall, a membership survey, and a new committee for diversity, equity, and inclusion. Along with these efforts, welcome now to TeamPeds Talk, a new podcast forum with conversation series, the first of which is surrounding child health equity. As experts in pediatrics and advocates for children, we are leaders in providing high quality continuing education for advanced practice registered nurses, but we recognize we need more continuing education on social determinants of health. And that's where TeamPeds Talk comes in. This is a weekly podcast series with 30-minute episodes featuring you, our experts all over the country. These are pre-recorded interview-style chats featuring the expertise and experience of pediatric APRNs who work to impact child health equity. We need your voice to make this happen. We are looking for primary care voices. We are looking for acute care voices because we know that social determinants of health are not respective of primary or acute care environments. And just this week, I saw a topic about health disparities and racial disparities in outcomes for pediatric surgical patients in intensive care environments. So we want to hear all of the things. The topics that we're still looking for are food insecurity, housing instability, poverty, high school graduation and transition to enrollment in higher education, language and literacy and health literacy, civic participation, discrimination, and access to foods and support healthy eating, crime and violence, and environmental conditions. So if that's you, if you're working in any of those kinds of patient populations where you are going to make a difference, then we need your voice to help us create an inclusive, accessible, and diverse forum to raise awareness of issues impacting child health. These are 30-minute pre-recorded conversations with me on Zoom that we'll use and publish in a podcast style. Application is easy, preparation is minimal because we want to hear what you're already doing. The best part, this is going to be accredited continuing education, and the creme de la creme, it's free. It's free not only to our members, it's free to anyone who wants to access it to listen. This will be a great resource for faculty who are looking for content for students and to hear about experiences. So who doesn't like to listen to a podcast, and especially one that's free and offers free CE? It is a win-win-win for everybody. So once we launch in August, we encourage you to visit PCE at ce.napnap.org. In addition to earning CE for individual episodes, participants who earn credit for all 16 parts of the series, that's 8 hours of education, 16 weeks starting in August, will go right up to the week before Thanksgiving, will receive a certificate of completion for the National Association of Pediatric Nurse Practitioners curriculum on child health equity. So please help us to continue to be experts in pediatrics, advocates for children. We need your voice. If this is you, we'd love to have you on the show, and we'd love to hear you listen. Thanks so much and have a great day. Thanks for all you're doing to impact child health.